My name is Dr. Scott Spavi Provencio. I'm actually a resident physician at Mount Sinai Hospital. I do both adult internal medicine and pediatrics, and I actually primarily work at Settlement Health Center, which is in East Harlem, and we're always happy to see new patients. Today, I'll be talking about kind of what's going on with COVID right now. What are we seeing this summer, specifically in New York City? I'm sure a lot of us are kind of sick and tired of hearing of COVID. We already know COVID. You don't need to tell us more about it. We've already heard about it. Why won't it go away? Why do we keep hearing about COVID? COVID is a virus. This started in 2020, and we've seen multiple different iterations or versions of this virus. So this is what the COVID virus looks like on a microscopic level. It's a cell. This is the virus itself. And inside it, it has, similar to DNA, like humans, it has information that kind of allows the virus to operate. And outside the virus, we have these things sticking out that you may see in the red called spikes and proteins. And these proteins and spikes, they can mutate. And every time that there's a new season rolling around or we have new vaccines, the virus mutates and it tries to reinfect everybody all again. So unfortunately, it's becoming almost a yearly thing, like a seasonal thing where we're seeing COVID mutate and become different variants, as we call it. So you probably know the flu virus or influenza, very similar to flu. The flu mutates every year, and that's why we have to get vaccines every year. So similar to COVID. But this summer, we've been seeing what we call the flirt variants, which is a funny name. Many of you may know flirting, when someone is trying to get with someone else or be cute with someone else. So it has a funny name, but this summer, we're starting to see a spike in what we call the flirt variants. Here is some data from the CDC, the Center for Disease Control, for all of the United States. What I wanted you to pay attention to is these curves that we're seeing. So if you look at these curves, we saw a lot of COVID last July, so last summer. This is 2023, and then it kind of went down and then went up again around winter. And now look, we're seeing a huge uptake, a huge increase in COVID this past month of July. So this box that I have highlighted, test positivity, it means of all the people who are getting tested for COVID, about 14% of these people are testing positive. So this is a pretty high positivity rate. It means that a lot of people are starting to get positive for COVID again, as we're seeing with the graphs. These are just other markers or indicators that we trend and follow. So we're also seeing an increase in emergency room visits for COVID. Kind of similar. It was like last summer, and then it was really bad in the winter, and now it's starting to increase again. We're also seeing a little bit of an increase in hospitalizations, and unfortunately, we're seeing a little bit of an increase in death, but not so much. This is the trends that we're seeing right now for all of the United States. And I really do believe that this is because of the new variants that we're seeing, the new COVID variants. So now we're looking, this is New York City data from newyorkcity.gov. So what's happening in New York City? I have highlighted here that in the last 7 days, so just this last week of July, there's about almost 900 new cases of COVID every single day. So this is the average for every single day. So we're saying almost 1,000 new cases a day of COVID in New York. Obviously, there's a lot of people in New York, but I think a lot of us have seen or heard of people who may be getting COVID again, who may be having some respiratory symptoms, but we are seeing a huge amount of people testing positive for COVID every day this past month. Also, these are some numbers for hospitalizations, but luckily in the last week, we've had no deaths from COVID here in New York. These are some graphs that I think are really helpful. This graph is showing, again, the total number of cases that we're seeing in New York. So this shows all the way from the beginning of May all the way to the end of July. And as you can see, like we are seeing more cases over the summer. So this dark blue line, this is all ages, all people. So we are seeing an increase throughout the summer of COVID in the city. But if you look at these numbers, the vast majority of cases are for people above the age of 65 and above the age of 75. We are seeing most of these cases amongst the older population in New York City. And then, I don't want to scare anybody, but of course, because we are seeing more cases of COVID, we also are seeing more people hospitalized for COVID. This dark blue line, this is like the average increase of people hospitalized for COVID in the past summer from May to July. And it's been kind of a slow increase, not as much as the other one. But if you look at the people age 75 and older, there's a huge increase this summer of people getting hospitalized for COVID. Luckily, no one has died from COVID, but it's getting severe enough that people are requiring hospital visits. Sometimes that means requiring some oxygen in the hospital. And unfortunately, for some people, even getting intubated because their lungs are not able to do well with the virus. So we are seeing this for people over 65 and definitely people over 75. This graph shows us the number of COVID cases per neighborhood. This is looking at hospitalizations. The number one neighborhood in New York that's having the most hospitalizations and COVID cases actually is in Hunts Point. But if you look down here, we have Central Harlem and Washington Heights, who has kind of a high rate of COVID right now this summer. And then a little lower, we have Upper East Side, Lenox Hill, and then East Harlem, thankfully, actually is like way lower on the list. I had to copy paste it into here. So way lower, but we do have an increase of hospitalizations and cases for COVID in East Harlem as well. So what can we do about it? But we should be aware that COVID is increasing again right now. This summer, we have seen an increase in numbers. And I think we still need to be careful because unfortunately, COVID has not gone away. And like I explained at the beginning, there are different variants. Very basic stuff that we've been saying since 2020. Hand hygiene actually is so important and goes a long way. Carrying around hand sanitizer is actually very effective. Using hand sanitizer if you go on the subway, if you are going in public and opening doors to your bodega or to your restaurant, make sure that you sanitize your hands after before you eat or touch your face. And also if you're talking to people, consider social distancing. So social distancing, what that means again is just being careful of how many people you hang out with, how many people you interact with, and how big the groups you are interacting with. So we know that because COVID is a virus that's transmitted through the air, through our respiratory systems, we know that it is safer to be outside with a group of people than it is to be inside. If you're going to see some people this summer, if you're going to visit friends, maybe consider doing it outside. Of course, I know everyone is aware of probably the different types of masks that we've seen in the past. So here, I think most people tend to have or have seen like the surgical masks or the cloth masks that a lot of people made. However, it is really important that if you are really trying to avoid getting COVID, or if you have COVID and do not want to pass it on to someone, one of these masks alone is not effective enough. If you are going to use a surgical mask or a cloth mask, they actually recommend combining them, wearing them both together or wearing two of the surgical masks. One mask alone, unfortunately, is not effective enough to totally prevent COVID. However, if you are able to have access to the N95 masks, which look like this, or the KN95 masks, which look like this, those are pretty effective, a lot more effective than these masks because they fit tighter on your face and they also have better filters. So if you are able to get access to these masks, they are a lot more effective with preventing COVID transmission. Like any respiratory disease, like lung infections, pneumonias, other viruses like influenza, we know that smoking cigarettes or any tobacco products or even vaping makes it really harder for your lungs to clear those infections. Your lungs are already working hard enough, when you have a virus. So if you do smoke, it's going to be even more difficult for your lungs to deal and heal from the virus, which is probably why we're seeing a lot of hospitalizations as well. Unfortunately, we do have a lot of pollution here in New York, and it's not always possible to avoid the pollution. But if you go outside, especially if it's a day with a lot of smog or smoke in the air, consider wearing a mask. Then living healthy. Obviously, our bodies need to be strong to fight any sort of infection or prevent getting sick. So it's really important to just live healthy. So drinking lots of water, eating good, nutritious foods, and also getting some physical activity, making sure your body's in a good state in order to fight infection. So that even can mean walking in your neighborhood, if you're like running or even going to the gym, that is all very effective. However, if you are going to exercise inside in a public area, you may want to wear a mask as well. And then the last thing, which I think is really important to remember, is that if you have a chronic disease or medical condition, that actually puts you at higher risk for getting more sick from COVID. So for example, people who may have diabetes, high blood pressure, asthma, lung disease, or other autoimmune conditions like thyroid diseases, just any other kind of chronic medical condition can put you at higher risk of becoming more sick from COVID. If you have diabetes, make sure that you're taking care of yourself, you're taking your medications. If you haven't seen your doctor in a while, it might be a good time to go see your doctor and refill your medications and make sure that everything's under control so that you have the best chance of being healthy if you were to get sick from COVID. Most importantly, vaccination is actually really effective against preventing COVID, and not just preventing COVID, but also preventing getting really sick from COVID. And I think that's kind of one of the misunderstandings about vaccination is that we think vaccination might prevent us completely from getting COVID. Well, unfortunately, that's not the case. Plenty of people who have been vaccinated and gotten boosters actually have been getting COVID as well. But we know that actually vaccines can help you get less sick from COVID and even prevent or reduce the effects of what we've called long COVID. We're still studying a lot. A lot of doctors, don't have a lot of information about it just yet because COVID is so new. But we are seeing people who have had difficulties with their lungs, with their brains, and with their heart kind of long term. So you may kind of have chronic fatigue or tiredness. You may have difficulty breathing for a long time. And a lot of people have like brain fog or feel like they're not thinking straight. And these can be effects of long COVID. But vaccination can actually help prevent and reduce the effects of long COVID. It is important to get vaccinated. Some good news is that we are having these new variants, but the CDC, again, from the US, is producing new vaccines and they will be available this fall and winter. So they will be provided by Pfizer, Novavax, and Moderna. Those are the companies. If you haven't gotten a vaccine, I might wait from not getting one right now, but then contacting your provider, your doctor's office, and seeing when they're going to get the new vaccines. So hopefully this fall, maybe September, October, November, we'll have vaccines, and I encourage you to go get vaccinated. That way this winter, you don't get sick from COVID or as sick if it continues to rise. Really important, 3 important groups who we really talk a lot about in terms of preventing COVID is people over the age of 65. I shared those trends, the graphs with you, kind of showing who's being most affected. And we know that people over the age of 65, unfortunately, have weaker immune systems and need a little bit of extra support. If you're pregnant, the body's immune system is a little bit weaker, and we obviously don't want to have any complications during the pregnancy. So we do encourage vaccination. It is completely safe to get a COVID vaccine while you're pregnant and actually may have some benefits for the baby. If you have a chronic condition or disability, whether that's a heart condition, diabetes, lung condition, lung disease, thyroid, it is important for you to get vaccinated. It is completely safe for kids above the age of 6 months to get boosters and vaccines. So if you have a kid who you want to get vaccinated or you have a grandkid, they can get the COVID vaccine starting at 6 months of age. Where can you even get this help? Where can you get tested? Where can you go get vaccinated? Most important is if you have symptoms, we do recommend getting tested and isolating or trying not to get other people infected. COVID symptoms can look like a variety of ways. We think that COVID might be associated with coughing, and it sometimes can be, but now we're seeing a lot of COVID present with headaches, stomach aches, diarrhea, sometimes sore throat, and then of course, sometimes coughing and difficulty breathing. If you have any of these symptoms, if you feel like you might have an infection or not know why you're feeling sick, it is important to get tested and then consider isolating. If you get tested early and you do test positive for COVID, ask your doctor if you qualify for COVID treatment. We do have medications that will help reduce the severity of the infection and also can help prevent hospitalization and long COVID as well. So New York City Health and Hospitals, they are doing testing, vaccination, and treatment if you don't have a doctor or the doctor's office is closed for any reason. So this is the phone number you can call, 1-844-NYC for NYC, and you can get a hold of New York City Health and Hospitals, find out where is close to you and how to get tested and vaccinated. And then there's also something called Virtual Express Care. This is being put on by the New York City government, and they are doing vaccines and treatment as well. And this is the phone number that you can call, and you can talk to someone over the phone if you qualify for vaccines, where to find vaccines in the city, and how to get access to treatment. So this phone number is 212, and it spells COVID-19, but the numbers are 212-268-4319. This is East Harlem, and this is Central Park. And these are some places that are offering vaccines and help right now. So it's kind of hard to see, but on the map right down here, this is the Metropolitan Hospital on 97th. So they, like I said, they're doing treatment and vaccines. A lot of this pharmacies, so there's a CVS on 96, the Dwayne Reed on 102nd, another CVS kind of more in Central Harlem on 116th. Again, I work at Settlement Health. We're a clinic and we accept most insurances or no insurance. We also accept sliding scale. We are located on 106 and 3rd Avenue. This is my card. This is my name again. If you want to make an appointment with us, this is our clinic phone number. You can call and make an appointment. If you want, you can ask to see with me, and this is our address. But if you already have a doctor, please go see them and you can ask them about vaccinations again this fall, or you can ask them about potential potential treatments if you do get sick. And of course, it's always good to get checked up and take care of your chronic conditions if you haven't in a while. There's probably like 3 variants that we're seeing, and they're from a family of variants that we're calling the flirt variants. If you got a booster maybe in the spring or last winter, we do think that there is still some protection for sure. However, this new vaccine coming out in the fall, we believe will be a little bit more targeted towards the current variants, kind of like how we have the flu vaccine every year as well. If you're over the age of 65 or have a serious chronic condition, if it's been over 6 months since you last got a booster, I would probably go ahead and get it just because we are seeing so much COVID right now. You can always get the new vaccine later. So again, that's for people over 65 and people who may have already existing chronic diseases. If you're younger than 65, if you're otherwise relatively healthy, then I would probably wait just to get the newer vaccine that may have a little bit of extra protection. COVID treatments are changing all the time. So if you were hospitalized for COVID, we are still using some drugs to help fight it. So we still have something called remdesivir. It's an antiviral medication that is very safe and also good to use against COVID. So sometimes we still use it in the hospital. Most people, hopefully will not have to get hospitalized for COVID. And we do have pills that you can take outside the hospital for a couple days. Paxlovid is kind of the main one we use in the clinic. Just to clarify, anyone can qualify for Paxlovid, any ages. Either way, ask your doctor, but it is especially protective and especially helpful for those who are over 65 and have chronic conditions. So again, those are just unfortunately kind of a more at-risk group with COVID. COVID is like any viral illness. Lots of hydration. Stay hydrated and make sure you're drinking a lot of water, electrolytes, Pedialyte, and make sure you're still getting good nutrition. Make sure you're getting a lot of sleep and rest. If you work, try to take a few days off work so that your body can rest and recover from the virus. The medication is helpful, but most importantly, you got to keep your body strong and rested.